Namaskar, welcome to PK's classes. Today we'll study a new laxative drug, that is Tenapanor, which acts as an inhibitor of sodium hydrogen exchanger type 3. So sodium hydrogen exchanger, it is named so because it exchanges sodium with hydrogen. Sodium moves from the GI lumen to the epithelial cells of the GIT, and in exchange of hydrogen which moves from the epithelial cells or the enterocytes to the lumen. So sodium moves from lumen to the epithelial cells in exchange of hydrogen which moves from epithelial cells to the lumen. So this is sodium hydrogen exchanger. And sodium hydrogen exchanger type 3 is located in the GIT towards the apical membrane towards the apical side or apical membrane. So the enterocytes, the epithelial cells of the GIT, the side which is located towards the lumen is called the apical membrane, and the side which is located towards the subepithelial space is called basolateral membrane. So towards the lumen, in the apical membrane, sodium hydrogen exchanger 3 is located, and Tenapanor inhibits sodium hydrogen exchanger 3. So by doing that, it inhibits the absorption of sodium, and in this way the sodium concentration in the lumen increases. And when the sodium concentration in the lumen increases, that induces osmosis. Because we know in osmosis there is flow of solvent from low concentration to high concentration. So since the absorption of sodium is inhibited, sodium concentration in the lumen increases, and because of that there is low concentration of sodium inside the cell, and because of that there will be flow of water from low concentration to high concentration. So that is our osmosis, and water will move from the low concentration to high concentration, and there will be paracellular movement of water, and that increases the water content in the lumen. So the bulk of water content in GIT increases. That increases the peristaltic movement, and also the water content softens the stool consistency. In this way it shows the laxative action. So Tenapanor, in addition to inhibiting sodium absorption, it also inhibits phosphate absorption, and both these actions can have its applications. So Tenapanor can be used in treatment of irritable bowel syndrome, which is constipation dominant, IBS-C, and also can be used in hyperphosphatemia by decreasing the phosphate absorption in CKD patients, that is chronic kidney disease patients. So these are the two main uses of this. And Tenapanor can also be useful in hypertension, because by decreasing the sodium absorption, it decreases the water volume, and because of that the blood volume also decreases, and that can be useful in hypertension by decreasing the blood pressure. And because we know that sodium actually causes the water retention, and when water retention occurs, that increases the blood volume, and that blood volume increases the blood pressure. So it can be useful in hypertension, and when there is also water retention or fluid retention, that increases the workload of heart. So in heart failure patients also they can be useful. This by decreasing the blood pressure, in hypertension patients and by decreasing the workload of heart in heart failure patients. So the dose is 50 milligram twice daily, which can be used immediately before breakfast and dinner, and side effects are diarrhea, abdominal distension, flatulence, dizziness, etc. So this is all about Tenapanor, the sodium hydrogen exchanger inhibitor. Thank you.